Dental Soundbites bonus content.
Hello. I'm Dr. Effie Ioannidou.
And I'm Dr. Arno Wright. Welcome back to another bonus episode of Dental Soundbites. We're having a conversation about how the innovations that are connecting patients' oral care to the rest of their health care are changing the dental profession with Dr. Jonathan Levine and Miss Maria Filipova.
Why do you think that the investment on oral health, innovation, or, technologies is so limited? Someone can react and say, it's a matter of priorities, right? We don't prioritize oral health. The society doesn't. But do you think it's something more than this?
I'll give you my 2 cents. I want to hear Jonathan's clinical perspective too. There are a couple of myths, and we love dispersing myths on our podcast. One of the myths that is widely shared is that dental as an industry is small. The reality is we spend over $160 billion in dental spending. It's projected to grow to over $180 billion by 2025, 2026. So as a market, this is not an insignificant market to go after, contrary to what most investors might believe. The second myth has to do with the fact that it's psychologically perceived that dental is not a critical component of health. And you're a periodontist, Dr. Effie. If I had my wish, jokingly, I always say that I would like to make periodontal disease have more painful symptoms.
True.
Because by the time you start feeling symptoms, it's too late.
Yep.
Yeah.
Right. And so it's one of those things where we just put it to the side. And if patient is a single mom taking care of 2 kids, trying to juggle jobs and everything else, this tends to fall by the wayside. And the myth is that if you don't do that, the rest of the family is okay, which is not necessarily the case.
Yeah. The clinical corollary to that is if you were walking down the street and you had a cut down your arm and it was wide open, you'd go to the emergency room and do something about it. But in chronic inflammatory disease, where you have these pathogenic bugs that get into all these organs of the body causing systemic inflamed diseases, it's this silent killer that, Effie, what did the Surgeon General talk about that? What was that, 20-something plus years ago? So the truth of the matter is, Maria, your point is well taken. And really, we want to be able to raise awareness. I think it's an awareness problem. Maria, we call ourselves optimists. It's starting to move in the right direction. Awareness is getting built because of the research and the science and the new technology kind of converging together to raise awareness about the relevant importance of the connection of oral health and overall health.
Let me just make a quick point here. We went through maybe a century of oral systemic, if you will, understanding. And then the last few decades, you're right, we looked into this more specifically. And we, as dentists, as the dental community, I think we took it to the extreme and we made some risky statements, right? Risky statements as of, floss or die. So I think on one hand, we took it to the extreme. On the other hand, we tried to justify our importance through systemic health, which I think is great. Yes, there is a connection there. But oral health is health. Maybe we can just rest our case and say, listen, it's important to have good oral health, just for the sake of the good oral health.
Yeah.
I just feel that we don't need to be that running after the physicians, if you will, to get importance. And I get what you're saying, and I completely believe that the medical and the dental profession should be connected. They owe to the public to be connected. But on the other hand, this connection is not that will make us important. I think by ourselves are important. As Jonathan said, we are the physicians of the mouth.
I couldn't agree with you more. I agree with that, but the relative importance to connect to medicine is not because, I want to achieve my success by connecting to medicine. Honestly, I don't care too much about that. What I do care about is the outcomes of my patient.
Yeah.
And let me give you, for instance, that if I have a patient, maybe pre-diabetic, that I do medical baseline, and I think that this patient's pre-diabetic and has some gingival inflammation, I want to be able to work together with my medical colleague.
Of course.
If I have a patient that I do CBCTs in my practice as a standard of care, so is salivary diagnostics, pH testing, oral cancer, and we collate scans, intraoral scanners, and we collate all this information together. Well, you know what? If I find something, I want to be able to have a medical colleague talking. And to Maria's point, we need to have a shared medical record so that we understand what's happening, let's say, cardiovascularly.
Of course.
So I think from an outcome for patient health, and we like to say oral health is health care, that, because we're the tip of the spear of diagnostics, they come to us more than the physician. We can really get very much focused on more of a wellness model than the sickness model, what I was talking about before.
For sure.
Yeah.
I like that. All right. Thank y'all so much for being on the show today.
Thank you for having us. This was great.
Absolutely a pleasure to be on the show. Thank you so much.
Thank you, guys. It was so nice. And if you like this episode, share it with a friend. Then be sure to subscribe to this podcast wherever you're listening so you can get the latest episode. You can also rate, write a review, and follow us on social media.
Dental Soundbites is an American Dental Association podcast. Learn more at ada.org/podcast.